How do doctors repurpose drugs for sex health? Imagine taking a medication originally designed for one health issue and finding it helpful for another. That's what drug repurposing is all about, especially in sexual health and managing sexually transmitted infections. Doctors look at existing drugs with known safety profiles and see if they can be used in new ways to treat or prevent STIs. This approach helps address challenges like antibiotic resistance and offers new options for patients. One common example is antibiotics like doxycycline. It was first used for bacterial infections, but now it's also prescribed after exposure to certain STIs. Taking a 200 milligram dose within 72 hours of risky sex can significantly cut the risk of infections like syphilis, chlamydia, and gonorrhea. This method, called post-exposure prophylaxis, is especially popular among men who have sex with men and transgender women, as part of a broader sexual health plan that includes regular testing and counseling. The effectiveness of doxycycline in this role is supported by scientific studies and guidelines from health authorities. Another way drugs are repurposed involves antibiotics like linezolid, which is used for resistant bacterial infections. Researchers are exploring its potential for treating neurosyphilis because it can cross into the central nervous system and target the bacteria causing syphilis. While promising, it's still under study, and caution is advised due to resistance concerns. Similarly, cefixime, an oral antibiotic, is being tested as an alternative for early syphilis treatment, with some small trials showing high cure rates. A newer antibiotic called zoliflodacin, originally developed for gonorrhea, might also have future uses against other STIs like syphilis. Antiviral medications initially created for other viral illnesses are also being repurposed for genital herpes. Drugs such as acyclovir, valacyclovir, and famciclovir are now standard treatments for managing herpes outbreaks, helping reduce symptoms and frequency. For human papillomavirus, or HPV, topical therapies have been developed to improve management options beyond traditional methods like removal of warts. To make treatments easier and improve patient adherence, many antibiotics have been reformulated into single-dose pills. This means a person can take just one dose to cure infections like gonorrhea, chlamydia, or trichomoniasis, making it simpler to complete treatment and lowering the chance of spreading the infection. Addressing antimicrobial resistance is a major reason for drug repurposing. When standard treatments stop working, doctors may turn to higher doses or different antibiotics such as moxifloxacin or tinidazole, guided by resistance testing. This helps keep infections under control and prevents the spread of resistant strains. All these efforts are part of a comprehensive approach to sexual health. Doctors combine drug repurposing with counseling, regular testing, vaccinations like hepatitis A and B, and connections to HIV prevention or treatment services. This holistic approach ensures better health outcomes and helps individuals stay safe. In summary, doctors repurpose drugs for sexual health by carefully applying existing medications to new treatment or prevention roles. They relying on scientific evidence and guidelines to make sure these strategies are safe and effective. This method helps tackle emerging challenges like drug resistance and expands the options available for managing STIs. However, it's always important to consult healthcare professionals for personalized advice, as individual needs and circumstances vary.